Hi, Ruth McLeod on Our Nursing. So tonight I pose the question, where does our faith and our belief system, where does that fit with all of this? So when I was a kid, my dad was an ear, nose, and throat surgeon, and I would go with him on rounds a lot in the same hospital that I do some of my work in now, and it makes my heart full. But anyway, one day we were going into this patient's room who he was doing surgery on the next day, and he asked the patient, would you like me to pray? And the patient was like, oh, yes, doctor, I sure would. Well, later I was like a little stunned, and I asked my dad, Dad, do you really think that these patients, need to believe that God has to be in the room for them to be okay? And he was just like, oh, Ruth, one day you'll understand. Well, now years later, I'm older for sure, old for sure, and I pray with my patients if they ask me to do that. I don't push it on them, but I can kind of read it when that would give them solace or comfort. And it's not at all like uncomfortable for me. At first couple times it kind of was, because it's not something that I do a ton even for myself, but like I really wanted to give that to my patient. I remember when my dad prayed, one of the things that he said was, Father, please guide my hands tomorrow. And that was interesting to me. Now years later, if I pray with a patient, I am like, you know what, Lord, please help me to have a steady hand while I put them on this treatment. And at first I thought, boy, I hope that doesn't sound glib, but because I really felt it with all my heart. And then after I did that, and the first patient said, thank you so much for praying with me, and I thought, you know what, Dad, I kind of get it. You're right. I kind of get it now. So, you know what? If your patients need that from you, give it. Don't throw out your whatever they need you to be and to do for them to bring them solace and comfort, then you do that. And if it is, say, a prayer to guide your hand, do that. Boy, we sure all can't be perfect, and any guidance we need is probably good. So, as always, do unto others. Don't be afraid to shout out who you are. Give the patients what they need, and if that's a prayer, pray with them. So, on Our Nursing. Thank you guys. Bye.